Everybody, Travis Robbins from RobbinsRehabilitationWest.com. It is a .com, but I mean, I don't know why we call it that. I'm here with Dan and Nick. You know us by now because you have been watching some of the other videos about our physical resilience outlook testing. Today, we are going to go over agility testing. Agility testing is something that we feel is very important, but often neglected, especially as you age. I would think universally, almost everybody, if you've gone through a public school system at least, has done some version of agility, maybe not testing or completing like a full examination, but probably in gym class or physical education, you've worked on agility or done some kind of race or something like that. But we're going to go through what we have decided is a really good example of what you should be working on, especially as you age. So the test, Dan, I don't usually share my screen during these because my browser is quite full of tabs, as everybody knows. But what I'm going to do today is share my screen because it's really hard to verbally describe this without some kind of visualization. But if you guys are watching this on our online platform as well, you'll have an example of this. But it's a three cone drill. Dan, do you want to explain the three cone drill with the advantage of having the picture in front of us?
Sure. So yeah, it's called the three cone drill, but we obviously have four cones there. The first two are just kind of the starting line, and then a cone goes 5 yards from that, and then kind of off at an L, you'll have a third cone 5 yards from the second one. And with this test, you're starting on the line. You're going to run to the first cone. You have to bend down, touch the line, run back, touch the start line, and then you're going to go back around. The second time you hit the second cone, you're going to run around it, out around the third cone, around the second cone again, and then through the finish line. And you're doing this as fast as you can, um, safely.
Got it. Okay, so you got to touch the floor. Dan, what happens if you go from cone one, you go to cone two, and you miss touching the floor? Do we start the test over?
Yeah, we'll have to do it again.
Yeah, so false start kind of a thing. So yeah, you're basically running from one place to another with some anterior posterior motion, some lateral motion, and you're getting a time. How long does it take you to do this specific test? So Dan, let's decide or let's talk about why we decided to do agility first off, and then we'll kind of talk about why we chose this specific test. Why is agility important as you get older?
This is just going to be a big indication of like fall risk, your ability to like correct any loss of balance, changing directions, things like that, which are yeah important, especially as you get older to avoid falling.
Okay, we have corollaries of this or different versions of this that are more standardized and have been researched a little bit more in the physical therapy world. Nick, like, what are some examples of that where we would test something that looks similar to this but not quite as advanced?
To me, the first one that comes to mind is the tug, which is a timed up and go test, where you start seated in a chair, you go walk around or like touch a line that's 10 feet away and come back and sit back down in that chair, where it's like, okay, you have to do it as fast, same thing as possible, but that's not usually where you're going to be even, you're not having to bend down to do something. So that's the one that I think of the most.
Yeah, I think that's really important addition to what's happening here. Not only do you have to be able to navigate this course, but you gotta be able to touch the ground. And for some people that might be younger or in really good shape, it might seem inconceivable. Wait a second, like all you do is go down and touch the ground. It can't be that hard. But some people don't do that in their everyday activities, and they tend to lose that movement as they age. So the things that I've seen when I've done this with patients is that's where they're going to struggle. Like either they have a lot of difficulty getting to the floor, or they just don't do it because they're scared of some kind of fall. So, Dan, if someone was struggling with that, what would you think would be issues that they're having, kind of more on like a specific movement level that they would be that you would guess they were struggling with if they can't touch the floor?
Um, Probably just kind of some lack of like strength and maybe mobility through just like the hips and the knees. Just that it would be pretty similar to like their ability to squat.
Yeah, I think strength, mobility, balance, like either fear of falling because they don't do that, they don't feel comfortable getting into that position, or if they just don't have the soft tissue mobility to get into that position, they're going to struggle with it. And even if they can do it, they're going to have to slow down quite a bit in order to accomplish that. And the point of this is to get a baseline, understand how fast you can do it, and then do things to help improve that. So we'll talk about that. The typical disclaimer of we're going to stop doing this test if you feel like you're having pain with any of the movements, or if you feel a significant balance issue. Like if you feel like you're going to fall over, then at that point, we're going to stop the test because you certainly don't want to do that. Scoring the movement. So, Dan, let's just go over, I don't know, let's take someone that's ages 60 to 79. If we're going to do a point system, so all of these go on a 10-point system, the highest one, if you can do that in under 17 seconds at that age, then you're going to get a 10. I don't know what your guys' experience has been, but when you've been doing this with patients in the higher age ranges, are you finding that people are pretty successful and it's surprising you how well they're doing, or are they kind of on the lower end of where you would expect them? Oh, we'll ask Nick, I guess.
I'd say it's either they do fairly well or not even close. I don't see as much on the in between, because I think the people that are doing fairly well, like, yeah, they have that strength, that range of motion, just that ability to get down to touch the floor. Um, and I think just some of the confidence to be able to do so with the balance part of it, right? And then you have somebody where it's taking them 3, 4 times as long just because they get there, they have to control themselves to stop, go all the way down, and do that on multiple cones, making it actually quite a bit slower then.
Yeah, so you guys, if you're listening to this, you're going to have access to a chart that will give you your scoring. But to give you an idea, ages 20 to 39, we expect you to get that. In order to be a 10, you should do that in 8 seconds or less. So those cones are 5 yards apart, and you have to get through that motion in 8 seconds. So I encourage you to try this out at home. No, I did not. I think I got like an 8.6 or something, which I think would have put me somewhere. No, wait a second. I'm in the 40 plus. Oh no, I did better with that. So I'm 40 to 49, just sneak in there. So that's good. But certainly something that I need to improve on. If you are in 40 to 59 age range, you're expected to get that done under 12 seconds if you want to score a 10 on that. If your age is 60 to 79, it's under 17 seconds. And if you're above 80, it's under 20 seconds. So it gives you kind of a general idea of how you should be scoring. We've talked a little bit about this, but anything you want to add, Dan, in terms of why this is important? If you had a friend or family member that you really cared about and they scored really poorly on this, kind of what's the conversation that you have with them to say, hey, I get it. You're probably not playing pickup soccer over the weekend, and this isn't going to necessarily give you an advantage on an athletic field. What is the sales pitch to be like, yeah, this is something you should focus on?
Yeah, I would say mostly like a lot of the other tests, it's a good indicator of just how fit you are, and like explaining to them like how bad fall risk is as you're older. This is probably a really good test to see how they would do managing like loss of balance just with all the direction changes and bending. So really important to prevent like falls and broken bones. And then too, just like it's going to be like, since you're trying to move quicker, those type 2 muscle fibers we've discussed before, those power fibers that are really important to just keep up your quality of life.
Nice. And it might seem pretty obvious to me. Maybe Nick can enlighten me with something that's not obvious, but we tend to lose this as we age because we just don't do a lot of this kind of activity. We exit our athletic peak usually in some high school or maybe some college sports. Not many of us are going on to play professional sports where this becomes part of your job description, being fast, but we tend to just not do these things as we get older. Any other reasons you can think of, Nick, why we lose this as we age, and anything to add to what Dan said is like, hey, this is kind of important. You might want to work on this.
No, this is really if you don't use it, you lose it. And this is something I think that really does speak volumes more about this one is because, okay, even if we're just talking like single leg balance, or if when we're talking just the jumping that we've talked in other ones, like that's one thing at a time. Like this really does combine a lot of that movement, that mobility. Just I really like this test, and does, I think, just speak volumes going forward, whether you're younger, older, anywhere in between.
Yeah, I think if you're good at this, I think that says a lot about your resilience. I know you overuse that word in this situation, but if you can do things quickly, safely, it probably is going to spill over into other things. If you can do a three cone test quickly, you're probably not going to lose your balance going up and down stairs, carrying things, going places quickly. You're just going to be more athletic and more resistant to bad things happening to you. So improving the movement. So Dan, you wrote the programming for this. Aside from doing that activity, and that's a really good exercise just to do the three cone drill. But what are some other things if people score low on this, things they can do to try to help improve their score?
So it's gonna look like a lot of your basic lower body exercises, squats, split squats, lunges. Definitely trying to get them into some like even low level plyometrics like jumping rope or just basic hopping. But those things and just like moving quickly, that's where the hopping and the plyometrics would come in. But yeah, overall, it's just get your legs strong enough. That's going to help like with decelerating at all the turns and the changes of direction that you have to do, as well as like bending down to actually touch the floor at each line.
Yeah, and I think this, like many of the other movements, it's just cool to see improvement. So if you start out somewhere and you're not very happy with your score, it's not the end of the world because if you're starting out low, there's a chance you can make some big improvements as you retest this. And it is a lot of people that I talk to, my patients are like, I don't really need to do that anymore. And all the things that we've talked about have supported the fact that, yeah, you don't need to, but it's probably a good strategy for longevity. Just being able to get from one place to another quickly when you need to in certain situations can be helpful. All right, you guys have anything else to add? I mean, in terms of the equipment, it's pretty straightforward. We have cones. You don't have to have cones. You can have a chair, paint a dot on your pavement, chalk, anything. Do it safely. Make sure it's a flat surface. And supervision is always great because physical therapists can help you, give you some tips and pointers on that, and provide a safe environment. It's something that we do in our physical therapy clinics for sure, but pretty minimal equipment, something you can definitely do at home, and something that I hope that we have explained is beneficial to improve as you age. You guys good? Anything else?
Nope.
All right. So should we test Dan today? Here's to better health through better understanding. All right. We'll see you guys soon.